before the testing, you click on the name of the person, and then you click on testing, and then you click on measurement. If the skin is very good moist, then usually the test goes pretty well. If you see the message coming on the screen, the electrodes cut off, that means that the skin is too dry and you need to reapply some water. So right now the measurement is over, we say okay. So after the first test, you want to see the result, and for this you click on the button circular diagram. So when you click on the circular diagram, you see the perfect aura, the perfect one. To see the aura of the person we just measure, we click on the select measurement and then the time. Now you see the person aura, and you see that it has some deformation, and you also see that those things are like they are blue, and it tells us that she has some chronic conditions and depletion of the energy. So now we want to demonstrate you how with the therapy of bioresonance therapy we can change the aura from the treatment. For this we're gonna go to a BRT. We have two modes here, machine modes, automatic manual modes, which you pick up yourself. We always pick the machine mode, automatic, machine cup. So now the computer is picking up the specific program for this person, and after this we will be explaining if we should do a short therapy or longer therapy. So the short therapy is recommended for the people who you don't know yet, for the new clients, for the new patients, because we don't know the reserve adaptation in those person yet. So in this case, the machine put for us 4 minutes for each meridians. We're going to change it to 1 minute each. The short time therapy you do somewhere from like 3 to 5 minutes. And then after this you're gonna click start. So as you see here, the first one is not the meridians, it's a mode. And this mode was picking up for this particular client vertical mode. It's usually they put that mode, the computer choose that mode if person has not enough energy. And then the machine also pick 2 meridians, which is for urinary bladder and kidneys. And interpretation of those meridians, you can look at this chart. This program has more than just standard meridians. It also has meridians by fall, BRT, Bioresonance therapy. Okay, it's an endogen therapy. It's an endogen healing therapy. And endogen means that the frequency comes from the person's meridians. Okay, not from outside source. After bioresonance therapy, we're going to test the person again. So we click on the page testing and then measurement. We're doing the repeat test with the purpose to see what happened after the therapy, how the person's body reacts to the therapy. If you don't plan to do anything else, you just need these measurements, and this point of time you just take all the electrodes off of the person. If you plan to do a testing, let's say of some supplements, or let's say of the crystals, then you keep the electrodes while we're going to test the supplements with this plate on the device. Now we're going to the window dynamics. There are 2 measurements here. This one was before 1907, 17, and here we're going to put a second measurement, 1933. It's a time. We're comparing 2 windows of this dynamics. This was before the test and this was after the test. We're comparing them and see what happened with the columns. The height and the color of the column will tell us and what what organ's situation is. If there is a green column, that means it's a normal range. If it's all kinds of blue, that means that the person has either some chronic condition or not enough oxygen. And the red column will tell us if there is any acute situation in the body, acute symptoms, intoxication. The first attention we should bring to the shortest column, like this one. And those the shortest one are usually like have a color of purplish. So we click on that column and we see which organ is affected. If you click on each column, the computer will give you information of which organ is affected and also the reason why it could happen to this organ. For example, right now it's saying that we have a thoracic duct flow and thymus gland, significant hypofunction, and why it could be secondary immune deficiency or high latent chronic infection. And in this situation, you can click on each column and see all the explanation of everything. We can also look at the same graphic in another perspective. We click on the for all organs, and now we see a different graphic. So it's the same information, but just in a different pictures. You're going to see three lines: red, green, and blue. Green is normal, okay, normal state. Red would be hypofunction, too much, and blue is a hypofunction, not enough. And the control measurements you're going to see in the yellow line. If you see that in this case, like yellow line go above the green line, you can say that the person has more like hypofunction in the organs. So the pink line here, it was before therapy test, and the yellow one after therapy test, control measurement. And as you see that the pink and yellow are the same, they kind of merge with each other. So it didn't make much change. It tells that the person has a low reserve of adaptation. And in this case, to do another bioresonance therapy will be useless. So now doctor says take electrodes from her. And we're going to look at all the measurements now and learn that. And she recommends to put on the person photonic crystal. So we measure her again once more and see how the photonic crystal helped her. The doctor now made a very good point, which I forgot about. She said never put hands electrode together. Also the legs electrodes shouldn't be also together if the device is on. Why? Because it can destroy your device. Now we're going to go back to the interpretation of the test. Let's go to a circular diagram. Here we have a function of compare the measurements, and then we select the time before and after. Now you can visually see her aura before and after the test, and as you see that there is no much change, which tells us that she has a low adaptation reserves. So when you look at this 2 hours, right, before and after, you can see that the second hour is got a little bit like it shrinked. It got a little bit worse than before. Okay, then you look at the numbers, and the numbers in the blue circles, and compare those numbers. And as you see, for example, here was 40, here is a 44. It tells that it got even worse than it was before. That means that the person has some chronic condition, or in this state for a long time. To get out from this mode, we need to click on the compare measurement first. There is no other way to get out of this mode. When you look at the hour, look at the lowest numbers you see, and in this case you see 60. It's the lowest one she got. So we click on it. When you click on this number on the right window, you're going to see explanation of what's going on in the body. For example, in this case, we can see like accumulation of the unrealized emotions, backward ideas, dwelling on the past. and possible changes or psychosomatic reasons you can also see right here, and it could be insufficiency of breathing, pain, cough, decrease in the volume of breathing. So you can see here symptoms and psychosomatic. So the next thing we're going to look at the chakras. We click on the chakras, and you know that the chakra is also connected to the organs. We can click on each chakra, and then the menu you can see what descriptions of this chakra, what it does, symptoms of imbalance, colors, and other information. The state of the chakras you can see from how many rings it has. Okay, the 4 rings is the normal state of chakra. Less than 4 is the hypofunctions. More than 4 is the hyperfunction of this chakra. Every chakra connected to different, to few body systems and organs, and in this case, you can see that the numbers could be different. And for example, in this case, she has some normal and some hyperfunction in this chakra. Like in this case, in the upper chakras, you can see hyperfunction in red, right? And then another side is normal. So it's because each chakra connects to different systems. You don't have to, but you can also see it in, select the measurements and see it in, so you click on compare measurements and you can see the chakras before and after. You don't have to do it, but you can look at it also. To get out of this mode, you also have to click on the compare measurement. There is only can be one characteristic of the black chakra. That one you're going to see this way. It's going to be just 1 ring, and after the therapy it's still going to be 1 ring. That's when it's a characteristic of chakra is black. So if you're going to see a black chakra on the 3rd, 4th, 6th and 7th chakras, those 4, right? So if they don't change before and after, and it's going to be to stay like 1, closed chakra, that tells that the person has a spell. Now let's go look at the spine. So every vertebra is also connected through the nerves with different organs. And by pressing on the body of the spine, you can see on the right side pictures and descriptions of what it connected to, with what organs or system it connected to, by clicking on the body of the spine. In the first column, you're going to see the name of the spine. We have like 7 cervical spines, we have 12 thoracic, 5 lumbars and sacrum. Okay, and then the second column, you're going to see a deviation from normal of each spine. It could be hyperfunction, like in this case. It could be hyperfunction, like this case, or it could be normal. We should bring our attention on the highest number on the spine, like this ones. And if we see something higher than 65, that means that the person has a serious deviation from normal, and organs could be affected. The color of the spine of the column can also tell us some information. If we see in this case like a lot of blue, means that the person may have a chronic condition, or the person is dehydrated, doesn't drink enough water. The red one will indicate that the person either has acute situation, allergy, or autoimmune disorder. So now we're going to look at the 8 system and organs. So when we look at the system, and there is 8 systems here, in this screen we're going to pay attention on the second column and the third column. The second column shows the risk, how much risk it has, the organs, and the third column shows the reactions and toxins and structural deviation of normal or organic changes. If it's before the 4, 1, 2, 3, 4, it shows that it's not pathology yet, it's just slightly changes. 5 to 10 is already a slightly change. slightly change, not just tension, but already change in the organs. 11 to 20, if there you see the number 11 to 12, it's already a disease. Let's just again repeat. So 1 to 4 is tension, okay? 5 to 10 is the beginning of the disease, just starting. And 11 to 20 is a full-blown condition, or full-blown disease. If you see the number more than 21, it tells that the organ is already destroying. But we always have to look with different tests, because sometimes high numbers can be also shown to you if the person has a big intoxication in the body. So to measure it again, we're going to a client, it's already selected, we do testing, and then we click on measurement. So to compare what happens with the crystals, right, we need to choose the time. So the first one, we choose what we did for her, like the first original test. Okay, we put the date and we put the time. And then the right side, we put in also the date, but the time we just measure after the crystals. Okay, so we put before and after the crystals. You can see visually that she has a positive change after the crystals. Her aura is like more open, more full. And the numbers, those numbers are lessened. So whatever 10 minutes of the crystals we did, it says this big positive change she got. If you wanna also, you can look at the difference in the chakras. Okay, before, we can click before and after, and compare her chakras. You can see her third chakra and fifth chakra have more rings after the crystals. Now we're gonna go from this mode by clicking compare measurements backward, and now we're going to dynamics. Also we put the time before and after. So you can see that the dark blue columns change to a lighter blue, and they become like a little higher in height. It also tells that she has positive changes. Now we're going to window etiology. Now we're going to etiology and also select the time. On this page you see general results on our test. Okay, so on the first list you're going to see this kind of information. 1 second. So you see overall indication, general condition of the time, okay, violation of what degrees, then imbalance factor or pH, okay, if it's acidity or alkaline or balance. We also see here degree of risk in the basic systems in percentage for each system. You see the percentage of deviation. Yeah, you could see the lymph system and type of nerve system what she has, and a central nervous system, what degree of depletion, and allergy background. And at the low window you're going to see the same information after the crystal. So when you click on etiology and the second page, you're going to see all kinds of infections in the body by different classes like bacteria, fungi, viruses, helminths or parasites, protozoas. If you see the number 45% or higher, that means that all that infection is active. If it's less than 45%, you're going to see the sign here, like you can see an example in the second window, which tells that infection doesn't play that much roles at this time. Like you see here, 36%, less than 45.
So decrease.
And it says the obtained abnormalities are physiological in nature with their minimal severity and without obvious signs of pathology. So just like a minimal. Now we're going to look at the affected organs and the system. Okay, we click on the third one. Here we see that all that infections what we saw before and what organ they affected, and the higher the number, the more infected the organ is. And the next page is probabilistic diagnosis as probabilistic. Okay, maybe. On the same page, you can also see the deficiency of the vitamins and minerals. There is also nutritional advice here. We're only going to put on nutrition. You see the product which is recommended and the product which you should exclude from the diet. Here we don't need to see in comparison, we just see at the first time test. Now we're going to reports. So first we put the right time of the first test, we select it, and then you do activate each window, okay, one by one. You activate it. Here in the rankings we put text view and to sort by the measurement. If you want to see in comparison your reports, then you need to pick the time of the second test and then click here and check mark the mode of comparison, and it will show you the time what you're gonna compare with. She doesn't recommend to do a mode of comparison in the chakras, spine and circular diagram, because in the reports you won't see much information, you're gonna just see the pictures if you do that. If you don't do that, that you'll see more information and like attachment of this chakra to these organs, it will just open up more. Okay. When you work with Natalia as a doctor, she will always ask you not to even do the mode of comparison. Just do it without, but to give you a report of the one test separately and the second test separately without any mode of comparison, just 1 and 2. So you need to select a printer, and she recommends to choose the fax for the reason that in another formats a lot of information will be cut off. Okay. In this format you see it, everything fully. You put the check mark, always use this app, so they won't ask you questions again. The first one which was suggested. There is you can see that this report has 14 pages and this is the first list. So you have 14 pages, that one was the first page, and then you can just click on the arrow and see the rest of the report. Now you close that page, not just like minimize, but completely close it, and that report is going to be in this folder 2002. And from here you can send this file through the email or put it in a flashcard or wherever you need. If you want to finish, you can just click on the exit. If you want to do more therapy, you go to return to the testing page. For example, you can also here do a harmonization. So this is another therapy, right? If the BRT, bioresonance therapy, was working on the meridians, the harmonization therapy works on the psychosomatic and emotions of the person. So if in Bioresonance therapy, the program will be chosen for you automatically, here you need to decide what mode to put. It's either sedation, toning or harmonization. And to choose this program, you need to look at the test first and decide what the person needs. If you see in the test a lot of blue colors prevalence, then you will pick the toning mode. If you see a lot of red colors on your testing, you will put sedation mode. If you see 3 different colors sometimes, green and blue and red, all mix, then you just put harmonization. Okay, so minimum time of harmonization is 7 minutes. So you put 7 minutes, you do start, and after 7 minutes you need to do measurements again to see the difference. Okay. After the therapy, right? So after the harmonization will be finished, you go testing, and then you go measurements. If you see the good change in the testing after this, you can continue harmonization and do another 7 minutes if you see the positive result. And you can extend this harmonization up to like 21 minutes, so do it 3 times. If you look how prolonged the results gonna last after the therapy in comparison, the BRT will last you about 1 day, 24 hours. The harmonization therapy can last you a few hours. She would recommend to do harmonization for practitioners a few times a day to balance yourself in your work hours. You can also measure all supplements, how they are good or not good for the person. To test the supplements, first you need to prepare all the supplements, okay? Then each pill or a capsule, you can either put it like in a plastic bag on a certain, separated, or you can also make like put the paper in the plate and put the sample here. Okay? So we're gonna test, for example, 1 pill, and then we can test 2 pills or 3 pills and see what the optimal for the person would be. Before the testing start, let's say we put the pills here. So when you put it here, you put in this window what we have. For example, we put Gazim, okay, 1 capsules. Every time you're gonna do testing on 1 capsules or 2 capsules, this picture of the person will disappear after testing, and every time you would have to come back and press on that testing again. If it's a liquid supplement, then you put some like a small glass container. It's the liquid, like 1 drop or a spoon. So now we're going to measure her with the first pill, right? We click on the testing, and we click on the measurements. The supplements and how it affects the body, the best way to look at the dynamics here. Okay, so we go to dynamics, and this is the best chart to look how effective the supplements. So this will be the original test, and this will be the test after 1 cup. So we finished the whole testing and everything, and after the test you need to clean the electrodes very clean, so there is no energy information left on those. So I asked her question like, what would you recommend to clean it with? Okay. So most of the time you're using the chemicals, but without chemicals, like more natural one. Okay, some cleaning detergents, but pick the natural one. Sometimes if person has lots of toxins, you can see like a black spots on the electrodes, okay, and that may not help. In this case, you can buy a bottle of lemon juice and clean it with lemon juice. You can also use baking soda or toothpaste with like a whitening effect. Okay, those things you can clean electrodes with.